Hi, I'm Dr. Larry Huppin. I want to talk today for a couple minutes about how to avoid neuroma surgery. So a neuroma in the foot is an enlargement of the nerve that travels usually between these two bones right here, the third and the fourth metatarsals. And I'm going to show that to you on the skeleton here. That's in this area right here. It can be elsewhere in the foot also, but this is the most common area. It causes pain in the ball of the foot, can cause shooting pain into the toes. Sometimes feels like there's a sock balled up under the arch of your foot or under the ball of your foot. What I really want to talk about today, however, is how to avoid surgery for this problem, because it's extremely rare that if conservative treatment's done correctly, that surgery is ever necessary. So when we look at trying to treat this problem, there's a couple things we want to do first. Number one, we want to shrink down the neuroma in this area. And number two, we want to get pressure off of it. So to shrink it down, we usually will start with a steroid injection, maybe two, and rarely, but sometimes three steroid injections spread over about 6 weeks. If you look at research on that, about 65% of patients that have those injections will have nearly complete relief of their symptoms. Now, the second part of this is to get pressure off of this area and get that pressure back onto the arch. There you're going to use some sort of orthotic device to transfer that pressure, again, from the ball of the foot onto the arch. There's studies that show that an orthotic that conforms very close to the arch, in combination with those injections, at that point, you're about 85% of patients will have nearly complete resolution of their symptoms. The next thing, if that's not enough, that 15% of patients who have not yet had complete relief of the neuroma pain will usually go on to a series of what are called sclerosing injections. And these are a weak alcohol solution that deaden the nerve. And there's a lot more information on those on our website. You can find that there if you want more details and want to look at some of the research. In addition, there are things you can do with your shoes to prevent neuromas from causing pain and to help get rid of the pain that's associated with them. But number one, certainly make sure your shoes are wide enough and they're not compressing your foot at all. Go to a good shoe store where they really know how to fit shoes. And for women who are looking for attractive shoes that are still fairly good for people that have neuromas, instead of looking for standard heels, look for heels that have a platform on them. That platform also makes the front of the foot of the shoe rigid, so you can rock through that step. And because you can rock through that step, you're not having to bend your toes. That takes tension off the nerve. Also, just having this, what's called rocker on the shoe, transfers pressure off the ball of the foot where the neuroma is and gets it farther back. So those are just a few hints on how to avoid neuroma surgery. Don't have surgery until you've tried all of these treatments first. Again, a lot more information on all of this on our website.